Patient undergoes laparotomy for peritonitis. On post-op day 3, he develops pus discharge around the suture line and fever. What is the Southampton score? So Southampton score and the other one is ASEPSIS score. They are post-operative wound scores or wound grading. Okay, they are scores or they are types of wound grading. Basically, they will tell you the severity of wound infection if it gets infected. Obviously, grade 0 means it has healed normally. Nothing has happened. Grade 1 is okay, very mild, like just some bruising, some erythema, nothing. Where should you be careful? Erythema plus other signs of inflammation is going to be grade 2. Okay, you don't need to know the subtypes, at least know the basic types. That erythema plus some signs of inflammation is going to be grade 2. And this is where it gets tricky. Grade 3 and grade 4, there will be some discharge. In grade 3, there will be serosanguinous discharge. And grade 4, which is a major complication, there will be purulent discharge. Grade 5, tissue has broken down. Tissue is gaped. Normally in practice, we diagnose wound infections either in grade 3 or grade 4. They are where we will diagnose them clinically. Grade 1 and grade 2, we don't even diagnose. We just see a little bit of redness, we attribute it to something else. Serous discharge is grade 3. Purulent discharge is grade 4. That is what you should know. Here there is purulent discharge, answer is going to be grade 4. That's how you should think, right? This is a trick question. This has been asked in a lot of entrances, not just at a PG or a UG level, but entrances across, because you know, this asepsis wound score, the components are given by the name asepsis. So you have A for additional treatment, S for serious discharge, E for erythema, P for purulent or pus, S for separation, I for isolation, S for prolonged stay. And you score the person. Okay, you give the person a score. Higher the score, more severe is the wound infection. And they will give you options arising out of these letters asepsis only. But where will you make a mistake? Is serious discharge a marker of wound? Of course it is. Pus, obviously it is. Erythema is, right? It is also in Southampton score. I for induration is wrong. I stands for isolation of bacteria. Okay, so normally they will either give you a fourth S. So you have serious discharge, separation, stays prolonged, and there will be a fourth S, which will be the wrong one, or I will be replaced by induration, some finding instead of isolation of bacteria from wound. So you think like that, then you will get the answer correctly. You should know if they want to change the question or if they want to change the option, which one will they change? It will either be one of the S's or it will be I for induration, which is what I did in this question.